This position is going to go over a way to try and stretch your hip flexor, but maintain abdominal control. This is something that I think a lot of patients struggle with, is that when I have them try and stretch the front of their hips, their back immediately wants to arch. So I'm sure we've seen lots of people when they do a kneeling hip flexor stretch, that when they go into it, their back kind of drops into one of these, right? Even someone who's really flexible, right, they'll get into this position. Instead of actually stretching their hip flexor, they're just compressing their back and let their pelvis tip forward. So I really try to get someone to cue this control in their abdomen, but when I put them in a stretch, it's kind of hard. So what I'm looking for here is that I'll start off with just kind of a 90-degree angle at my knee, and this is right underneath me, kind of 90 degrees at this knee. And I want to see, starting off, either pressing down into the top of my thigh. You'll see how I kind of tuck my butt underneath, and that pressure down, I kind of pull my shoulders down, and I'm trying to get myself to engage my stomach. I'll even lightly press my back toe into the floor. And to be honest with you, already here, when I do this, I feel a little bit of tension here. Right? So you can see, and my hip flexors aren't dramatically tight, it's just that doing this right in this position, and especially pressing my back toe, I can feel a little bit of tension here. So I can do this on my own thigh. I can do this holding a post or a broomstick, right? So same thing here. I'm trying to think about pulling my shoulders down. I'm driving this post into the ground and seeing if I can pull my pelvis underneath me. And then relax, 3 to 5 seconds. And then relax. You'll notice, just as I do it facing you, this knee, I want it to stay straight, kind of pointing where my toes are, so I don't want to see this knee caving in or caving out. But this press down into the post is really getting me to tense my stomach and flatten my back. And I encourage you to use a mirror at first. And on most patients, I'll have them start off and I'll say, okay, try and keep your shoulders still. See if you can tip your pelvis this way, which you don't want to do, and then see if you can pull it this way. Most people, because they don't have this control, when they try and tuck underneath, they'll do more of this to get it, so they'll kind of round through their mid-back. I really want to lock my shoulders into place and see if I can isolate just the pelvis and say, okay, I don't want that, this is what I want. And then if this is okay, and I have good control here, well, next I may progress to a little bit more space between my feet, my front foot and my knee, and then same thing, keep that, and then start to slowly come into that stretch. Now even here, especially as I press that back foot into the floor a little bit, I feel this pull like crazy, right? But as soon as I let this go, even just a little, the pull completely goes away. No stretch. And I think that's the issue. Many people will think that they are really flexible here, but they're just not controlling the position of their pelvis. As soon as I do this, well, now that's really pulling. So this post, or just a press down into a knee, pressing down into something tends to help me engage my stomach and flatten my low back to get a better stretch.